Well, I've been an arse and I've also learned a valuable lesson. But the universe works in strange ways because you, as the person who's watching these videos, have just been spared probably the most boring video that I've made. I've just learned that if I delete some of the media off my computer before I actually publish something, I lose everything in CapCut. So I've just opened CapCut to finalize and edit and everything else, and it's all gone. And that took me hours of voiceovers and videos and templates and all kinds of shit. So there you go, you've been spared. When I went to bed last night after doing all of this, I thought, shit, that's 18 minutes of really boring material, but I'm not going to redo it again because I just can't be bothered. It took too long, the voiceover stuff was too difficult. But guess what? The universe has spared you, and Muggins here is going to have to do it all again. But I learned from last night, I'm going to make it much shorter, sharper, sweeter. Okay? So you've been bloody lucky. There's going to be two videos. This first one will have a little bit of a presentation. I'll run through all of the sort of questions you need to be asking, your initial consultation, you go to see a few doctors for second, third opinions, and then when you finally settle on a doctor that you're comfortable with, a hospital you're comfortable with, I'm going to run through all the questions you need to ask to make sure that you are at least comfortable with what you think will be the outcome. So that I'll run through that one. But also, you've made a decision you're going to get your hip replaced. There's a lot of things you need to prepare for in terms of your house. You'll be in hospital for a couple of days and you come home. You will need some adaptations in the house. And I've looked around, I've seen lots of videos of what's good, what's bad, and I've actually had a load of stuff delivered over the last few days, and I've unboxed it, and I'm going to run through it, and I'm going to tell you what I think of it. And I think we might actually build one or two of them together. Well, hopefully it's taken you far less than 10 years to get in front of a hip specialist and a hip surgeon, unlike me. So, your first question is, okay, what is the injury? Why is it causing me pain? You've said it's my hip, etc. Get it fully explained. What type of arthritis do I have? Is it osteo, etc.? Get them to explain exactly what kind of arthritis. Make sure that you understand what it is. And it's a bit like, it's not like cancer, but they class it in stages. End stage is normally where you would get a hip replacement or be prescribed a hip replacement. So what stage is it? Has there been any kind of causation? Is there something, an underlying root cause? Was it an injury? Are my other, is my other joint affected? Is my other hip joint affected? And what are the treatment options? I was given two, repair and or replace, and obviously I like the idea of a slightly less invasive repair than a replacement, which is why really you should be going to see 2 or 3 surgeons to harmonise in on what the actual option is for you. What are the risks and benefit of each treatment option? I mean, each one obviously has the benefit of the replacement is that it's done, dusted. The benefit of the repair was that it was minimally invasive and should be up and running pretty quickly. But unfortunately, in my case, it was the wrong diagnosis, and I didn't go for a second opinion. So you need to make sure that you have a harmonised opinion on what the options are, and then when you find out what your option, what are the risks and benefits. Is it possible to manage your pain in the meantime? Some people might be on NHS or long-term insurance, which might take a while. So you need to find out what it is you can to manage the pain. I've been in a lot of pain for the last 6 months, and I've really been struggling. I should have gone to a pain management doctor to look at the options. Some things like NSAIDs, non-steroidal anti-inflammatories and stuff like that, they're not very good for your gut. So again, these are things you need to be asking. Can we manage by lifestyle changes? What would those lifestyle changes be? Arthritis causes a lot of inflammation. There's a lot of natural ways to try and manage inflammation before you start hitting in with the heavy guns of non-steroidal anti-inflammatories. And would you actually, what would you recommend surgery now? I mean, and if so, what surgery? And again, these are questions you need to be asking multiple surgeons and harmonizing in on what that might be. Don't just take one guy's word for it like me. So you've homed in on the diagnosis. You've been to see a few surgeons, they harmonise in what your diagnosis is, and you've also harmonised in on what the surgery, the procedure, etc. is. So now it's all about finding the right guy to do that surgery for you, and that needs to be the critical one. You need to find the right surgeon. I've been to 3. I went to see 3. All 3 of them were excellent. 1 in the UK, 2 in Malaysia. The 2 in Malaysia were very good as well, but there was just one guy I seemed to be more comfortable with. All 3 have explained exactly what the options and procedures are, and I found something where I'm reasonably comfortable, and that's the choices that I've made. Now I've made that choice, then you really need to home in on the doctor himself and make sure that you know what you're doing. This next set of questions really are what I would say and what I feel are the most critical ones. I'd made my decision, I'd seen a number of surgeons, and some of these questions you need to really ask all of the surgeons that you see, not just one and the one you settle on. You need to try and ask them potential surgeons that you think may be doing your surgery. You need to ask a lot of these questions about them, but then home in on these questions on the guy that you've chosen, the hospital that you've chosen. So basically, you've decided on your surgeon, research the shit out of his background, really go to town with it, get as much information off Google as you can, use AI, use any tools necessary to research his background and get a really good feel for what he specialises in and who he is. I mean, some of the things that I look for: has he done a fellowship in hip replacements? The guy I've settled on did his fellowship in Canada, and all the fellowship really means is he has looked at hip replacement, that's his speciality, and he's done a fellowship in hip replacement. The good thing is I'm based in Asia, I'm obviously English, I'm a Caucasian. He's done his fellowship in Canada, so he's used to doing Caucasian hips. Caucasian hips, Asian hips are very different, so he's actually been doing hip replacements for quite some time on Caucasians. How many hip replacements does he do per year? If you're in the UK, you'll probably find your surgeon does 100 plus. Arthritis isn't as prevalent in Asia. Certainly in Malaysia, we're a small country, so my guy doesn't do anywhere near that, but he is doing at least one a week. So he's probably at the forefront in Malaysia. He's probably done more than most people. So he's probably the most experienced in doing hips here. And ask him which approach does he favour. We all have our favourites. I'm left-handed, some people are right-handed. I'm left-footed, some are right-footed. What approach do you've got? Anterior, posterior, etc. We all have a favourite thing. So we all find a way of doing something easier, and that's the same with surgeons. So the guy I've decided on, he prefers posterior approach. He has done anterior, but for some reason he doesn't like the visibility of the hip joint. He's just far more comfortable with a posterior approach, and I want my surgeon to be eminently comfortable while he's standing on it. He feels that he could do it standing on one leg, blindfold with one hand behind his back. That's the sort of thing, that's what I want. So not that I want him to do that, but that he can feel he can do that. That's what I'm after. And also, what kind of implant? Not all implants are made the same. So I've gone for titanium cup, which will fuse into my hip rather than being cemented in. It might have to take a couple of screws to begin with, and also the type of ball that goes into it. It's ceramic and polyethylene and all this kind of stuff. The expected lifetime of it's probably about 20 years. I'm quite fit and active still, but by the time I'm 80, I don't think I'll be that active. So that doesn't really worry me too much. But it's a good quality implant, and it's going to be around for some time. Ask what his revision rate is. I mean, his revision rate is how many people that he does a hip operation on that he has to revisit within a short period of time because there's an issue. Not because their hip is worn out, but because there's been some kind of mechanical issue or physical issue. That's a revision rate. Generally, you'll find revision rates are at around about 1% or less. Just ask him, see what he says. And also, everybody's different. I'm different, you're different, so ask him if he sees any problems with having I've wrote down a THP. I don't know what the hell a THP. It should be Total Hip Replacement THR. THP. I'm thinking of brown sauce, I think. But ask him if he can see any issues at all with having with you having a total hip replacement. Also, what kind of anaesthetic procedure would you suggest? In the US, it's predominantly a hip block and a twilight sedative, and that's to help people get up and about and get out of the hospital quickly because it's damned expensive. But you take your time. What are you comfortable with? What would you prefer? But also what your doctor and your initiative, what are they used to? Again, my guys far more used to using a full general anaesthetic. I'm going to have a talk over it the day before my surgery, and we'll talk through the options and what he's comfortable with, and I'll probably just run with what he's comfortable with rather than me. Why rock the boat if it works and if the outcomes are the same? And I've already asked him this question: what do you envisage as a good outcome for me? He knows my history, he knows what sports I play, he knows how old I am and everything else, so what outcome, and he's told me that he would hope that I can get back onto the golf course and be competitive on the golf course and get my handicap down, which is what I want. So that sounds pretty good to me. I don't want to run a marathon, anything like that. I'm not going to be an ultra runner. So he will know your history, make sure he knows your history, and find out what's a good outcome for you in his eyes, and see if that gels with you. How long are you going to be in hospital? It's a reasonable thing to ask. In Malaysia, it tends to be 2 or 3 days, 4 days. In America, it's a lot less than that. But just ask him how long, so at least you can plan. And does he recommend any specific physio protocols? Again, the surgical approach is about whether it's the anterior, the posterior, etc., lateral, and that does affect certain muscles. So there are certain protocols you need to follow with regards to physio. Some doctors just say walk. In fact, a lot of doctors just say walk. Some don't really recommend physio at all. Talk it over with your surgeon. There'll be some physio involved, but talk over the protocol and if anything specific to you. So do your research on the doctor. That's number one. Do your research. Write down all your questions. No point. Don't try and remember everything. Walk in with a sheet of paper with all your questions written down and tick the boxes. And also, I would recommend you bring somebody with you. You're always going to forget something. It is quite traumatic, so you will probably forget something. Have somebody who's either family who knows you well or a really good friend, and they probably will bring something up which you may have forgot. So that's always a good idea, is to have some not just moral support, but also to have some support for you and remembering what you want to be asking. And lastly, let's look at some just eminently practical questions, things you need to know. Something like, what is the total cost of the procedure? If you're an NHS patient, that doesn't really matter too much to you, but if you're private and you're not paying all of it, you still need to know the total cost. And the same with if you're fully private, it's still good to know what the total cost is, because sometimes a lot of insurances have a limit on certain procedures and a limit on the hospital rooms and all this kind of stuff. So just have a look at the total cost. And also, does the surgeon's office handle the vast majority of the admin? That's important because it can be quite complicated. The surgeon is involved because he needs to fill in a lot of forms. Does his office, his nurse, whatever, his admin, look after a lot of the authorization process? If you're not on insurance, what are the payment options? Is it credit card? Is it, do you take it on credit, on tick, whatever it is? What are the payment options? At the end of the day, this is your life. You want to get your life back, and in some cases, you are going to have to pay for that. I'm going to have to pay for some of mine myself. Simple as that. but I will get some reimbursement from my insurance. But hey, I want to walk again, I want to play golf again. And also ask him what happens if there's complications after surgery, the follow-up care. I was originally scheduled for a Saturday surgery, a week tomorrow, but I asked the nurse, the admin, basically, how many staff do you have after Saturday lunchtime? And she said, well, after Saturday lunchtime, most of them finish their shifts, and we operate at about 60% of the nursing capacity. Sorry, if there's a problem, I want to be at full capacity. Yeah, it's a bit morbid to talk like that, but at the end of the day, things do happen. I really want to have a full complement, so that if there's a specialist that I need at that time, and he's out with his wife somewhere, playing golf or gone fishing or gone shopping on a Saturday afternoon, I'm sorry, that's not for me. And the same goes for during Ramadan. Ramadan's not a time to be having surgeries in a Muslim country. You've got people who are very tired. Imagine being the last surgery of the day on day 27 of Ramadan. You've got very tired people. I've had bad experiences of that. So, yeah, again, find out stuff like that. These are just very practical questions to ask. Can you speak with other patients? Can he put you in touch? Hopefully you might have got a recommendation from some people who've been under this doctor before, and you'll get a glowing reference. But if you can talk to some of his THP, there's that HP again, HP source. If you can go and have a chat with some of his ex-patients, that would be great. And life expectancy of the implant we've talked about, and what are the restrictions, short, medium and long term, once you've had it, depending on the implant, depending on the surgical approach. Some do have restrictions, some have almost none at all. So just as a recap, be comfortable with your doctor, be comfortable with your hospital, and understand his procedural preferences, and hopefully you'll have a fantastic outcome. I'm quite comfortable with my guy, and I'm hoping that I've asked the right questions. He's answered everything that I really want to know, and I'm going in with my eyes open and hopefully a great outcome. And I hope you do too.
Oh, thank you so much.